Welcome, doctors. In today's video, we're diving into a crucial topic for healthcare providers, revenue cycle management, RCM, and the pressure hospitals are facing due to rising labor costs. As you know, RCM is essential for keeping your hospital's finances healthy. It ensures that patient services are properly captured, billed, and reimbursed. But lately, many hospitals across the U.S. have been grappling with significant challenges within their RCM operations, mainly due to rising labor costs. So, let's talk about how this is affecting hospitals and what can be done to address it. Labor costs are a major expense in hospital operations, especially within RCM departments. The workforce shortage is one of the biggest contributors. Hospitals are struggling to recruit and retain skilled staff, such as medical coders, billers, and claims specialists. On top of that, wages for these roles have been rising, especially in metropolitan areas where competition for healthcare talent is fierce. Add in the demand for remote work options post-pandemic, and hospitals are facing a very real challenge in balancing cost management with maintaining revenue integrity. And the impact of these rising labor costs? Well, it's significant. First, operating expenses are on the rise. Higher wages, overtime pay, and outsourcing fees all add up, making RCM departments more expensive to run. This leads to margin erosion, where expenses grow faster than revenue, even if your revenue stays stable. Delayed reimbursements are another issue, as staff shortages slow down claims processing and denials management, which can cause cash flow problems. Now, if you're managing a hospital or practice, you know that these challenges can become a real barrier to sustainability. But don't worry, there are strategies to address these pressures and keep things on track. Let's start with process automation. Implementing robotic process automation, RPA, and AI-driven tools can make a huge difference. By automating tasks like coding, claim scrubbing, and payment posting, you can significantly reduce manual labor, cut down on errors, speed up processes, and, ultimately, lower costs. Another strategy is strategic outsourcing. Partnering with specialized RCM outsourcing firms gives you access to skilled especially from offshore markets while still maintaining quality. This model offers scalability without the burden of fixed overhead costs. It's also essential to optimize your workforce. Restructuring teams and cross-training staff. Handle both routine and complex tasks can reduce reliance on temporary labor and make the team more flexible. Hospitals can focus internal teams on high-value tasks, while automating or outsourcing the repetitive processes. In addition, focusing on revenue integrity is key. Tightening charge capture, improving coding accuracy, and preventing denials can offset rising labor costs. By investing in revenue integrity audits and analytics, you can ensure that every dollar is properly billed and collected. Speaking of analytics, data-driven insights can also help. By using advanced analytics, you can identify bottlenecks, measure productivity, and pinpoint areas where labor costs are disproportionately high. This helps with smarter resource allocation and better workforce planning. Lastly, addressing staff retention is crucial. Reducing turnover can lower recruitment and training costs. Employee engagement programs, career development opportunities, and even offering hybrid work. So, what's the long-term outlook? Unfortunately, the labor cost pressures on hospital RCM aren't going away anytime soon. But with the right approach, blending automation, outsourcing, and workforce optimization, hospitals can maintain margins and continue to ensure timely, accurate reimbursements. Those who invest early in technology and data-driven strategies will be better positioned to manage these challenges and protect their revenue streams. To wrap it up, rising labor costs are reshaping hospital RCM operations, but by adapting with smarter strategies like automation, outsourcing, and optimizing revenue integrity, hospitals can safeguard their financial health. Thanks for tuning in today.